Acha nitumie link. So nikitumia utume wa group ama si utasambaza? I wish tungeza redirect lakini
Good morning. Wewe ni uliniambia hivi na umechelewa. Harakisha.
So good morning, everyone. My name is Dr. Newton Mwangi, County Secretary, and I want to welcome the entire Department of Health to this very, very critical meeting, whose purpose is to highlight or to give an update of what is going on in the meeting, and especially to the new employees of the in the Department of Health, so that we can be able to move on the same board. So let us start the meeting with a word of prayer. Lord our Father, we really want to thank you most sincerely for the gift of life, and also for bringing us to the county government to continue with our daily duties. Bless us as we do our duties. Give us a good beginning and a good ending. And Lord, once we have a successful meeting, we shall say thank you. In Jesus' name, we pray. Now, at this point, I would wish to introduce our new Chief Officer, Public Health and Administration, Mr. Eliud, who took over last week. He's coming from the Department of Infrastructure, and it is important that he say a word or two, and so that we also get to know him. Mr. Eliud, kindly come and say hi to the viewers.
My name is Eliud Maina, the new Chief Officer, Public Health and Administration. First, I would like to thank the Governor for entrusting me with this role. Ours will be simple, open door policy, and also hands-on policy. I want to encourage all my colleagues in the health sector to feel free to engage us when they have any idea or concern, and let's work together to improve our healthcare. Thank you.
So thank you very much, Mr. Eliud. We wish you well as you take us through the Department of Health with your wealth of experience, especially from the infrastructure. We know you are going to do a good job. We shall support you in your please keep on consulting, and I'm sure you are equal to the task. We have confidence in you. So this time around, I want to welcome the Chief Officer, Health Services, Mr. Karoga, so that he also welcome the new employees. We've got already engaged new employees in our department. This is a person who is in charge of employees in the department, and it's important he's also one or two words, especially to the new employees. Karibu.
Thank you. Thank you, CS, and Your Excellency the Governor, and on behalf of the County Government of Muranga, and in particular the Department of Health, we take this opportunity to welcome the new staff who have come on board. We have got new nurses, we've got new lab technicians, and soon we'll be onboarding new clinical officers. So we take this opportunity to welcome you. Feel free to work with us. Feel free to engage us. Wherever you feel there is an issue, feel free to reach out. Our numbers are out there, and we'll be visiting you in each and every station that you are working. In case there is an issue, in case you feel that there is an idea you need to share, in case there are issues concerning your work and working condition, feel free to reach out, and we are here to make Muranga health sector a better sector. Thank you so much, and God bless you. Amen.
Thank you, Mr. Karoga, for those very good remarks. And actually want to encourage the new employees, that is Muranga. We normally we are open, transparent in the issues. Kindly consult. Don't hesitate to consult the two chief officers, Mr. Eliud and also Mr. Karoga, should you have any problem. And we run through consultation. None of us know it's all. Therefore, this is your beginning your career, and therefore you want to build you slowly and gradually. Therefore, you need to use these people. Feel free, though they are chief officers, they are your people, and they are there to guide us. Well, thank you. At this point, I would wish to invite His Excellency the Governor to say one or two words before we move on. I mean, sincerely thank the Governor for also attending this meeting and also for the support he's giving us. Your Excellency.
So thank you, and I take this opportunity to say Thank you for those who have tuned in. We are humbled. You are doing a good job in the health department. It is our most important department of the county. It employs the largest share of county employees. Almost 50-60% of all county employees are in the health sector. And therefore, with the kind of work you are doing, we are very humbled, and we want to say thank you so much. You guys are doing a fantastic job. Without you, Muranga County cannot be there, and we can only say thank you. And we are glad with the kind of work that you are doing. We want to encourage you. We want to. We want to continue supporting you, and to say that you guys are great, and we support you, and we shall continue being with you in this journey to make Muranga Health great. However, there are some issues that we need to continuously inform you so that we move together because of the various changes that are happening in the health sector. So, the first one is we have two chief officers, that is Mr. Elliot and Mr. Karoga. So maybe one would inquire what is their role, what's their difference. So basically, Mr. Karoga role is human resource HR. So if it is an issue of transfer, promotion, disciplinary issues, it is Mr. Karoga who handles all those issues. Elliot now handles all other matters in the area of, let's say, for instance, purchase of medicine, non-farm. All those issues are issues that are very important to the management of the county. And therefore, if you have a problem that is about administration of healthcare that you may want to inquire or ask, so the person to follow up is Mr. Elliot. Maybe another question would be asked about the role of medics in the entire administration of the department. Yes, the CEC of the health department is a medical doctor, Dr. Mbugwa. We also have a director of medical of healthcare, who is Dr. Mburu. He's a medic, and therefore the role of a chief officer is mainly administrative, and therefore Elliot, notwithstanding not being a medic, he will definitely be able to undertake his roles as a chief officer. The second issue we wanted to discuss is on the issue of the changes that are happening in the national government health policy, which will definitely impact on Muranga County. The first is the issue concerning UHC workers. I know it is your desire that you transit into county employment, and we would really love to support that. However, this is a program that is not within our hands. It's a national government agenda, and we have we as a county government, we strongly support your proposed transition to come to the county, but we are bound by the rules or the contract that was entered between national government and the Council of Governors. It's our desire your contracts will be extended. We are aware they are ending, I think, in the month of July. As a county government of Muranga, we have no power to engage you directly. We have to await directions of the national government. But our position is that they extend your contracts because it is the right thing to do. You do a good job, and definitely If you recall, your contracts ended, I think, last year. We pushed for them to be extended, and that remains our point because you do a very important role in helping the people of Muranga. But again, we have to await the guidance from the national government. The second point on the national government interaction with the counties is on the program popularly known as MES, Medical Equipment Scheme. About 7, 8 years ago, national government headed by the then President Uhuru Kenyatta brought equipments. They were placed in our various hospitals. That includes Muranga, Marago, and other hospitals in the entire country, whether Nyandarua, Wajir, or Mombasa. The machines were number one, CT scan, MRI, and X-ray equipment. The new government, headed by our dear President William Ruto, once it came into power, was not minded, did not feel that it wants to extend the contracts. Therefore, the contracts ended late last year, and the national government did not extend those contracts. Therefore, the counties were stranded. One, they did not have funds to continue paying the suppliers to service those machines. Secondly, the suppliers were quite expensive, and we had not budgeted for that. We had thought the national government would extend that support, and therefore, unfortunately, those machines stalled. They stopped working. We, as a council of governors, we pursued the national government to continue with the service, at least until we do another budget, so that we now plan for how to deal with this medical equipment. But yes, the national government made a commitment that is going to extend those contracts up to 31st of March 2024. Unfortunately, so far, that has not happened. Because our patients continue suffering, the county of Muranga has decided to directly maneuver around that issue, and we are happy to report that we were able to revive 2 MRI and a CT scan, and also we are also able to, about 3 days ago, we got a new X-ray in Muranga Level 5 Hospital. It is being installed, and we hope we will, once we get funds, we will be able to ensure other hospitals have X-ray. In particular, hospitals that have high volume of patients. That is Kirwara. We know Maragua has, but Kirwara is an emerging hospital that requires an X-ray. Of course, Kangima, Kigumo, Kandara, we know they require it, but we are looking at our resources, and that's an issue that we are grappling with. The other issue is on the changes to NHIF. I'm sure you're aware the national government is moving to abolish NHIF, establish a new medical insurance, popularly known as SHIF, and that impacts on your personal interest. Why? Because Muranga County government entered into a medical insurance arrangement to cover your sicknesses with NHIF, what we call enhanced medical scheme. We wanted to support NHIF. That's why we did not go to the private sector. However, under the new law, the enhanced benefits cover is no longer available in the new body that will come after NHIF is gone. So that means we have to think well, we shall get a new medical cover for you, or in the alternative, we stick with the benefits that will now come under the new shift. We are not so sure whether the benefit package and the shift are sufficient or they mirror what currently you get under enhanced NHIF cover. And therefore, let us wait and see how the changes will come. But there is a high likelihood that we either stick with shift or we now look for a private player to cover your medical insurance. The other issue is the issue of medicine, lack of medicine and non-farm in our various medical facilities. Yes, we are aware of that public outcry and we are doing our best to stock our medicines and non-farm. The national government has delayed disbursing money to the counties. Muranga in particular is owed money for the last almost 3 months. We have not received our January, February allocation, and that hampers our delivery of services because then we need that money to pay your salaries, buy medicine, buy non-farm, and other programs that we are running in the entire county. But through God's grace, despite that, at least the county is somehow still functioning. The solution to that problem is in something called FIF, Facilities Improvement Fund law. There's a law that was passed by the National Assembly and the Senate about 2 months ago, which means that hospitals will now spend money at source. Before, let's say Kegumo, the money collected in any day would be channeled to Muranga, and then Muranga takes that money to Nairobi. And then if Muranga wants that money to buy medicine, it has to apply through control budget office in Muranga, again control budget office in Nairobi, finally to the treasury. That is a very long process, and by the nature of medical services, there's a lot of urgency, and therefore under the new law, now money will now stay in Kigumu, in Kandara, in all places, in all medical facilities, including our health centers, let's say Makuyu, Sabasaba, Donyushege, everywhere. So money will no longer be brought to Muranga. So to check on potential fraud of that money, we have automated that process, those systems. We want to thank our IT department for working very hard to automate that process. Therefore, the medical superintendent, let's say in Kirwara, will only go to a computer, requisition for fuel, request for fuel. Then that process is approved within about 4 or 5 hours, and then the supplier can bring the good. And then that supplier will be paid directly from Kirwara accounts. That transition might destabilize our delivery of services a little bit because once suppliers need to acclimatize with that new system. Secondly, we some people need also to get technological skills to be able to apply. But once that stabilizes, hospitals will be more independent and they'll be able to render more objective services. And therefore, probably maybe this persistent complaint of lack of medicine and non-farm might be cured to a certain extent. So therefore, we are urging you to wait a little bit and we see how those changes will help our health sectors. There are also two other issues. Mm, of course, the delay of getting money from Nairobi also impact on our ability to purchase medicine, because apart from the money being generated from the health centers, we still require the money coming from Nairobi. But we hope with the new independence of hospitals, they will get more resources and they'll be able to procure things at that level. And therefore, we ask you, as our people who are representing us in the grassroots, you hold a little bit, the system stabilizes, the hospitals will become more independent and they'll be able to make a better decision. And therefore, we remedy this persistent problem of medicine and non-farm. Related to that, with our automation of that issue concerning procurement, we used to hear a lot of complaints regarding that the supplies that the county used to requisition would not reach the facilities or would be overpriced. But with the new system, we suspect that problem will be remedied. To bring you to speed, we have now instituted what is called an internal audit report, a committee, an internal audit report, committee, to go to all our health facilities to look at our stores, see the weaknesses in our stores, and that way we hope this issue of medicine probably not reaching our hospitals or not being well managed will now be a thing of the past. Finally, let me mention an issue concerning automation. Yes, Muranga is at the forefront of automating many things. We are not doing this because of the next election. No, we are doing this for the benefit of people of Muranga for the next 5, 10 years, or even 20, or even 100 years when we are all gone. Because that is the future. The future is in technology, and those who don't take advantage of advancing technology are usually pushed out. So we have taken a conscious decision as a county to be at the forefront in digital transformation of various services, including health. We know that transition is not 100% good. Yeah, there are many teething problems that include downtimes. Yeah, we have had several unfortunate incidences where the system is down. Also, it causes us as employees to continue learning and relearning. Yeah, and therefore, that transition might take a little bit of time for it to settle down. Also, the system is not 100% perfect. It has some gaps that we continue together with the Ministry of Health IT experts remedying that system. However, I think it is the future, it is the best, and it will make you guys become respected because you will have acquired very good skills. We are happy to report that quite a number of facilities are now automated, although there are still so many gaps that includes insufficient machines, computers, laptops, but we are doing our best to purchase more so that we make our health facilities a little bit more objective. And incidentally, automation has also exposed some of the gaps that exist in our healthcare. A good example is we have been able to realize that we don't stock our medicine well. Yeah, we used to bring medicines that does not speak to the disease patterns of Muranga. Yeah, so I think that's an issue that we have realized. Secondly, we have also realized that we have inadequate staff. We have inadequate staff, yeah, in some core areas. For instance, nurses. And because of that, now we are being compelled now to engage more nurses, clinical officers. Take, for instance, Muranga Level 5 Hospital. The system shows on average the people who go to the hospital are 1,500. Previously, the records used to indicate about 700, but now the systems now shows they are 1,500 on any day. 5 clinical officers have to see all these patients. Surely that is inhumane, that is completely unfair. It is on that basis where we have thought we need to add more clinical officers. It's the right way to do. Otherwise, the 5 clinical officers will burn out. But again, we urge you when we want to congratulate the medics who have embraced the automation agenda 100%. We have seen people, medics in, let's say, Sabasaba Health Center, Makuyu, Ihiga Dispensary in Kangima, so many places really embracing technology. That is the way to go, and we are so proud of you. We know there are some computers that are yet to be delivered. We are pushing the suppliers to deliver them. We are also talking to donors to see whether they can help us buy more computers, but it has been a very important journey, and we thank you for your support. The other issue is about the card that which currently we give out to our poor patients, the Kanata Care card. That card has been quite important, but we ask when you talk to the patient, tell them that they need to look very carefully with the new reforms of NHIF, because there is a little bit of a possibility that they might kill Kangata Care. But we are trying to see whether we can rescue the program under the new regulations which are under consideration in the Senate. But it's an area that we are keenly watching. The impact of the new medical scheme on Kangata Care. And finally is the maternal support program, where we used to give a cash incentive to our mothers to come to deliver in our hospitals. The scheme, we urge nurses to continue enrolling people into the scheme, despite the mothers not getting money. There's a little bit of an audit that we are doing. We looked at the numbers of mothers who have registered. Then we try to check whether they are transiting until they deliver, and we did not see that correlation. So we are wondering, why is it that there's a very high rate of registration, but very low rate of delivery? On that basis, an audit issue was raised, and therefore we want to audit that system. Once we audit, then we will restore it, and and we continue with the program. But that is an issue that was raised. So allow me to end by saying that one, we are aware of the challenges that are there in the health sector, the issue of breakdown of critical machines, the issue of lack of drugs, yeah, in our health sector. We are aware of the complaints concerning lack of food in our sector, in some of our hospitals. But we want to give you an assurance. We are doing our best to remedy that. We hope with the new changes in the health sector, some of those problems will be remedied. Also, most importantly, we have realized there's a huge influx of patients to our main hospitals, that is Muranga, and we are doing our best to build more clinics in the rural areas, so that we try to reduce the massive influx of patients to level 5 and level 4 hospitals, because practically our employees have said that they are not sure they can be able to cope. And that is why we are doing a lot of opening of dispensaries, so that we reduce the huge influx of patients to our main hospitals. So therefore, we wanted the presentations that will be done here, they are all geared to bring you to speed with the interventions that we are doing to ensure that we push our health sector ahead. So and we are open. We listen to criticism. Ours is an open government. We believe in democracy, and also we urge you as medics. Whenever people complain against you, don't take it personal. This is life. This is a democracy. In a democracy, people have the right to say all manner of things. Of and For instance, we have seen some people sharing clips showing how services are not doing well in our hospitals. If you are not balanced politicians or leaders, we would have gone there and started harassing you. But we think we can't do that. It's unfair to do so. We can't come there and start harassing you so that we appear popular to the media or to those people doing that. The right thing to do is to investigate the issue, do something, yeah, as opposed to just being populist. So the point is, let us do things in a more methodical manner. We listen to criticism. Whenever we are criticized, we don't take it personal. That is democracy, and that is how life is in a democracy. We must agree to be criticized. The only thing I would urge employees is to, with the new automation, we can see a lot of things you guys do. We do not want to punish anyone, yeah, uh, because if we were to start punishing everyone, then we will reach a stage where almost every employee has been dismissed from employment, yeah. So our philosophy is to teach and try to educate our employees to do a better job. Of course, in the worst case scenario where there is serious allegation of misconduct, definitely we have to take action because this sector is very sensitive. We are dealing with human life. Yeah. But we are really now more minded to try to teach and talk to people so that we change and do the right thing, particularly because now with automation, we have a lot of data. But the best way is to continue training and talking to people, except in instances where there is grave allegations of misconduct on our part. So thank you. Let me now return it back to the CS. We continue with the meeting. Thank you.
Thank you, Your Excellency the Governor. We really appreciate your support and also the passion you have regarding the Department of Education and Department of Health. We really appreciate. We don't take it for granted. Number two, thank you very much for your remarks and also for the counsel and guidance you have given to the medics. Thank you very much and God bless you. At this point, you have the CC Health, Dr. Bugwa, and I'm sure some of the new employees may not know him, and it is important also that he make a few remarks. Karibu, Daktari.
Thank you, CS, Dr. Newton, Your Excellency the Governor. Thank you so much for facilitating this live stream of the Health Department, engaging our health workers. Good morning, everybody. We appreciate all our health workers. As a county government, we take you people very, very seriously. We know you are providing a very, very important service to our people. Health is very critical, and without health, we will not be able to achieve much in all the other sectors. I want to say that I know Governor has summarized most of the issues that were there for today, but I want to stress on a few more. One of them, which is FIF. In the past, it was there, and it helped our facilities to grow. It was what was called the cost sharing, where hospitals generate money, and the money is plowed back into the facilities for development, for procurement of commodities, so that then the challenges we normally have with commodities ideally from now should be a thing of the past. And the good thing is that the more that each facility is able to generate, the better your revenue income and the better you are able to afford most of the commodities that normally bring our work to a standstill. So mine is to encourage all our workers to continue being the good workers you are. We appreciate everything you are doing so that our hospitals can thrive, we provide better services, and we become one of the counties of excellence in health service delivery. I know His Excellency has commented about the workforce. It is true. Sometimes we are pushed to the end because of staff shortages. And the beauty of it is that the county government is very, very keen to see that most of these gaps are addressed. So I would urge fellow health workers that we be patient so that as we move on, we are able to fill these gaps and we provide our services according to our training and our abilities. So much for availing yourself and for make Muranga great in health service delivery, and we will depend on of you from the highest officer in health to the lowest officer in health. Each of you has a very, very important role to play, and we don't take you for granted. So thank you so much for your availability this morning and for your participation in this meeting. Thank you, CS.
Thank you, Dr. Bugwa. We really appreciate the good work you are doing in the Department of Health, and we want to assure you of our support so that make it as good as possible. So right now we have Dr. Radasha, who is in charge of digital system, and it is important that he also highlights on what we are doing as far as the digital excellence is concerned. Dr. Karibu.
Good morning, everyone. Thank you so much for the support you've given the digitization journey. One, I would like to acknowledge the effort that the staff have put in terms of digitalization. As you all now realized, I'm sure more than half of you have accessed the system and have interacted the system. At the end of the day, after a period of time, I usually ask this question to the health staff: is it worth going back to the manual system or going with the automated journey? And almost all 100% the staff say automation has made their work easier. They are more professional. The diagnoses have really improved. And also, even from the county perspective, visibility. Right now, at a click of a button, I'm able to know patient so and so Peter is in Ithanga are having these challenges. So we don't have to physically be in Ithanga. We can monitor that and we can help improve services. Also, in terms of advocacy, I know, for example, we hear a certain facility, for example, we hear there are complaints in Maragua, staff maybe are not seeing patient well. However, when you go to the workload, and actually you see patients are coming back to Maragua in numbers, it can only mean one, that services are being offered. Healthcare workers are giving quality care of service. So despite the complaints, we can see it's visible from the county end, and we continue appreciating. So far, the journey, we have automated all the level 4 hospitals and the referral hospital. We have done 10 health centers and we are continuing doing so, and 3 dispensaries. We are hoping by the end of next month, we can put a new target date of 29th of March. We'll have completed all this. At the end of the day, it will enable us procure more, procure based on what we need, and stock based on what our patients are requiring for their medication. In addition, something you have seen of late in terms of usage of the system is surveillance. We had a recent outbreak of malaria and anthrax, and from the system itself, we are able to monitor in a real time, which area to prioritize in terms of surveillance response. So I know some of the challenges that you've been facing include lack of printers, especially for the level threes. We have a challenge with the backup power generator. I know some facilities that have gone live, unfortunately, sometimes are forced to transition back to the manual system. But I know from the county perspective, these are things that will be continuously improved. Remember, at the end of the day, the bottom line is that book the patient used to carry, they used to buy 10 shillings. That is a thing of the past. And I think from a revolutionary point of view, it's very important, and we have historic data in the system. So I thank you, and I look forward for your support. Thank you very much.
So thank you, Dr. Natasha, for the good work that you are doing, and we really appreciate when our Department of Health is doing well in a digital system. At this point, I'd wish to welcome Dr. Karagao, maybe to shed more light on facility improvement fund. Maybe, although Dr. Boga talked about it, sorry, instead of that, because Dr. Bogo had actually mentioned about it, maybe Dr. Karaka, you can touch more on non-farms.
So thank you, Bwana County Secretary and our Governor. And good morning to everybody. And thank you for joining our live stream today morning. And I'll be speaking as basically one of you, because I am a frontline healthcare worker working in the hospitals, and also happen to also be a medical superintendent, so I also deal in a bit of management. So I'll just be touching a bit on the shortages of pharmaceuticals and non-pharmaceuticals, which we are all well aware about. And this just stems historically from the fact that after the previous FIF arrangement was abolished, is that procurement of both pharmaceuticals and non-pharmaceuticals has been centralized for a long time, meaning supplies would be ordered from the county, delivered to the county stores, and then distributed to the facilities. And we've all had experience with this, whereby we've had shortages. Sometimes what is supplied is not really what you need, which had been alluded to earlier. And these also led to issues with suppliers, bad relationships with suppliers, and a lot of defaults and basically stoppage of supply. And as one of you, I would say historically, I've had to deal with the issue of the shortages, whereby, essential commodities are out of stock. Patients are sometimes forced to buy them, which usually doesn't go well when the critics go online. And part of the problem is that being part of management, there is nothing as bad as having to cancel a theater list because you don't have a certain commodity, and you yourself are the med soup in charge of sort of trying to get that commodity. But that being that, we have all been told about the transition to the FIF system, whereby hospitals are meant to spend money at source. So the money generated at a certain hospital is meant to be used to sort out the problems of that particular hospital. This includes pharmaceuticals and non-pharmaceuticals, and this is a very good step. Another good thing that has happened is that with the e-procurement system, is that now ordering of commodities is now to be done directly from the hospital, so that, for example, the hospital I represent, Maragua, would know what drugs it needs, what maybe the orthopedic surgeon needs, the implants and things for ORIF, so we are able to order that directly. Then have the suppliers deliver them directly to the hospital, because like previously we said, things would be delivered to the county stores, then distributed. but now we are having a last mile sort of delivery system, whereby what Kigumo Hospital orders is delivered directly to Kigumo. And there is in place a receiving committee, part of the procurement team in the hospital, whereby, for example, if the orthopedic surgeon has ordered implants for the fractures and whatnot, he is involved in agreeing whether they are to be accepted to the hospital or the supplier should conform to what he needs. So I think it's a very positive step, both the FIF and the e-procurement system that has been digitalized. And in as much as, of course, it's a new thing, so there are teething issues, a bit of fine-tuning here and there, I do believe the future is bright, and urge you all to participate in it. And how you can participate, for example, is when the procurement officer in the hospital, the store manager, is making orders, make sure you are part of the process, so that, for example, you guide them to order the correct specification of items. And when they are being received also, the technical people are meant to give some input. And the other thing is to do it in a timely manner, so that, we have threshold levels to work with, so that you are not waiting till all the gloves are over in the facility. And then now, waking up one morning to make the order, so that we fine-tune the system to avoid these stockouts. And again, thank you for tuning in. And being one of you, I know exactly what it feels to lack essential commodities. I know what it feels to get, those Facebook posts that patients are being forced to buy gloves and drugs and such things. And hopeful with the new system, and we all try and support it how we can. So thank you, and let us engage actively. I can already see some people commenting on the chat. So yeah, feel free to engage. So thank you.
So thank you, Dr. Gadacha, for the good work you are doing, and especially to do the FIF, which is a new system in our department. So at this point, I want to welcome Madam Banse to talk one or two things on issues to do with HR. Kindly, Madam Banse. And then as she's doing a presentation, we welcome all your questions. If you have any issues, kindly, we shall be able to respond after Banse is through with the HR issues. Banse.
Yeah. Good morning, colleagues. My name is Bansi. I'm the HR in charge of health. Let me say we are not doing very badly. I know we have a very competent team in health. We have the right combination of skills. Maybe the only challenge we have is the numbers. I know we have a challenge with the numbers when it comes to the number of MOs we have, the CEOs, the nurses, and those are issues that we've raised with the executive. And from what even the governor said, he's giving us support, and we're going to have adequate staffing in our facilities. The other issue of concern that has been addressed is on promotions. Currently, we have 379 promotion requests, which will be approved next week. And we're also urging our members that those who are due for promotions should submit their application requests to the general office at the level 5 hospital for processing. We understand that stagnation can really impact on an employee's performance, and we are working very hard to make sure that we address that. We would want you to be to feel that you're growing in your career. So if there's anyone who has not been promoted and they are due, kindly submit your promotion requests. On discipline, I know this is also an area that is affecting health, but it's just a few officers who have discipline issues, and we are addressing all those issues, and we are giving you an opportunity to amend where you're doing things wrong. On the distribution of staff, we know there are some facilities that have no support staff, and we're going to sit down with the chief officer, Mr. Karoga, and redistribute the staff to where we have a shortage. I know there are some facilities which do not have watchmen, and they've brought a few complaints. They are being addressed. I think that is all from the HR desk.
Yes, can I comment something on promotion?
Thank you, Banse, for your remarks. Your Excellency, probably can make one or two remarks as we move on.
Okay, just to comment about promotions. We want to make promotion something that is merit-based and something that is more objective, as opposed to a situation where the people who get promoted are those who know the governor, who know the CS. So we are pushing the department of HR to prepare a promotion guideline. It will address several issues. Number one, it will indicate when do people apply for promotion. Yeah. Secondly, how do they do so? We are considering even creating a portal where people, let's say, they know if you want to be promoted, this is the time to apply, and you go here to a portal. We have had some complaint, people saying their application for promotion has not been received. The third angle, once that policy is out, is in the area of what will be the criteria to promote people. Remember, promotion is divided into two. Number one, there is automatic promotion. If you are a newly employed employee, you work for a certain number of years, then there's usually there's that rule under public service where it's like automatically you get promoted. But after you reach certain job groups, you stagnate. From there, that promotion becomes something that is at the discretion of the employer. So the second one, the second type of promotion is the one that we want to create clear guidelines where people come, probably they compete. We consider even doing an open test, yeah, so that it is clear. These are the reasons which have made you to get promoted. We hope the guidelines can be ready in the next 1 or 2. Let's say, give us ourselves 1 month. We'll publish them. Then we tell people, can you now apply to be promoted? The current method of promotion has been, people have complained, is unfair, and we'll develop those guidelines, not only for the health workers, but basically everyone who is working for the county government of
Thank you, Excellency, for the remarks. So far, so good. And at this point, I wish to welcome any questions from our staff, so that we can respond. And I'll allow the medics, Dr. Bugwa, Dr. Aracha, Dr. Kagao. Maybe they can help us in answering some of the sensitive issues related to medics.
They need to read the comment section, pick the name of the complainant, and then state it.
Yeah. So what we will do, we shall read the complaint from our screen, and then we shall be able to respond.
You name the person.
You name the person.
Yeah.
So from there, we have
Yes, maybe I can start. Yes, we can see a complaint from Bwana Anthony Maina Wamai. I think he's saying automation is just a simple fact, but why compromise on health service in the name of automation? No drugs, no food for the sick, critical machines. Thank you. That is noted. We shall endeavor to address it. There is a traveling nurse. She's asking about PNP for UHC workers. Again, as we have said, this is a national government program. It's a national government program which is beyond the county mandate. I'm sure you're aware of that. The best we can do is to lobby for the continuation of the program in COG, which we have done and we shall continue doing because we believe you are rendering a very good service to us. Thank you. Any other? Yes? Okay. A few minutes.
okay.
Maybe in the meantime, Dr. Bulwa, you can expound further on FIF. Eh? I think that's it. Specifically.
So thank you. We are still hoping to respond to any other issues our members may have. So thank you. I want to still comment on something else about FIF. Like I said, FIF is a bill that was passed and went through the normal procedure, through Parliament, through the Senate, and it is here with us. As a county, we have to implement it. And whatever funds we are generating, just like what FIF actually means, facility improvement financing. So we are going to use these finances to improve our facilities. And mainly we want to concentrate on commodity supply. I think Dr. Karangao mentioned something about that at length and how it is impacting very positively in our health system. Commodity supply is what usually puts us in negative publicity. Usually puts us in negative publicity. That we don't have gloves, we don't have plaster, we don't have this, and we want that this should be a thing of the past. I know some of you may wonder what will happen to facilities in level 2s and 3s that are not generating revenue. We are taking care of this. We are not leaving anybody behind. We are going to have the bigger facilities keeping some of their resources to run the level 2s and 3s. So for those of our staff, you who are working in our level 2s and 3s, do not feel left out. Whatever we are generating will also be used to support you. Procurement done to supply you with the necessary commodities. So there is no cause for alarm as far as the level 2s and 3s are concerned. But all in all, we want to encourage our facilities with the insurance packages that we are expecting to roll out after NHIF transits to SHIF, and everybody in this country is expected to be in the insurance scheme. So soon revenue, so that we can sustain ourselves in terms of commodity. Because remember, in health, our core business is service delivery. It is not to generate money. And once we generate this money, we plow it back into the system. And that's why it used to be called cost sharing, so that whatever we generate is plowed back and we address our core business of service delivery. So that is basically one of the things I would want to mention about FIF. And I would want to also mention that our hospitals used to have boards of management. The level 2s and 3s have facility management committees. They are going to be very, very key in management of FIF, such that the hospital managers will involve the boards and the management committees in executing the budgets that will be there in our facilities, so that it becomes a clean process, so that we don't end up in a situation where some of us might think the money is going into the wrong places. I think, like Governor said, we have systems that are coming up with the digital agenda that we have. We should be able to make sure that all the money you generate in your facilities is actually plowed back into service delivery and does not end up in the wrong place. So it is a good system. It will move us to another level. It will ensure that you people are able to work without any stress that this is not there, or this is missing, this dawa is not there, we are not able to offer this. We want, as a county government, that this becomes a thing of the past, and all our facilities should be able to sustain themselves. Of course, the county government might chip in some of the things that are too big for you to handle, but we expect that the basics should be handled at the facility without much worry. So we are happy to report that all of you are doing a good job, and we are sure that with this FIF, we'll even go better. So thank you so much. We have some questions.
Read the phone number.
So somebody 0726 905517.
Send your questions there.
Yeah. Please send your questions to that number. Can I read it again? 0726 905517. You can send your questions to that number. Then we are going to respond. Thank you.
Any question in the number?
Promotions are taking too long at the public service through HR, which is vindicating. The board has got no issues with the public service.
Okay. Can you read again? You read the question. I don't know whether they are hearing you asking. Can they hear me, sir?
Read again.
Yeah. I need to hear you asking that question.
The question is, why are our promotion taking too long at the public service, which is the HR, while the board has got no issue?
Yes.
Thank you for that question. One, I would want to say promotion are supposed to be based purely on merit. That's number one. Number two is also supposed to be based on availability of funds. Number three, promotions are supposed to be recommended by the department. So the Public Service Board, together with the SHIRA, because the promotion is supposed to be done within the SHIRA, we get recommendation from the department. Chief officer comes up with people to be promoted, deferred, and show the reason why they should be promoted. It's also supposed to be based on past performance of duty. Those promotions above job group M, they are supposed to be advertised, and then from there then interviews are conducted by a county public service board. And again, they are also based on availability of those vacancies. And as the governor had explained, we are coming up with a very objective system of doing the promotions so that objectively, so that everybody will have.
Next question.
Next question.
The next question: why not start employing UHC staff first instead of interviewing new workers? Another question still on UHC. We as UHC personnel tumekuwa demoralized kabisa, nguvu imeisha.
That one involves the national government, not the county government. So thank you for that question. So far, we have only those three questions, and we wanted to encourage you to ask the questions so that we can respond. And this is the best forum to ask those questions and to have them responded.
There's another question.
Okay.
It's on promotions. My question is on promotions. I think it would be fair to inquire from the national guidelines and also what other counties are doing. Thank you so much, Awaibu Governor and Health Management.
So thank you for that. And that one is well noted. We shall keep on consulting. And this was very good for that advice. Thank you very much.
Yes.
Yes.
Follow up on how far the county government has gone regarding the casual employees. Yeah.
We know that's an issue that is being addressed, and we know we cannot do without the casual employees. And as much as possible, we are trying to address the existing gaps. One thing we should realize is that with employment, currently in the county government of Muranga, the wage bill is above 45%, and we are required to be at least 35% and below. So you also have to strike a balance when you are employing to ensure that this one we are within, we are compliant with law, because this normally comes out during the audit queries. We want to be within the law as much as possible. So just bear with us, and we are trying to balance. One way of reaching the 5% that is allowed by the law is collecting a lot of revenue, so that then that 45% is lowered. The other option is to fire some of the employees, and we feel as a county government that is very, very unfair, and that is also very inhuman. So currently, we are trying to see how we can balance in a humane way. Just bear with us, just be patient, and that issue is being addressed. Thank you.
Can I re-emphasize? I think I get the angle. Yes, yes, it is true. Muranga County staff payments are above what the law provides. There's a law called Public Finance Management Act. It is the one that manages, or rather underpins, how we should manage county funds. There's a section there that says a county budget should not pay salaries above 35% of its total budget. Currently, Muranga pays 46% of its total budget to salaries, which is illegal. Every time we go to the Senate, we always ask that question, and the auditor is continuously asking us, why are you paying so much salaries? The solution to that is always either you push the revenue increases, which is what we are striving day in, day out to increase the revenue. Because assume, for instance, the county budget is 100 shilling and we are paying 45 shilling as opposed to 35 out of 100. So if you are to increase the money from 100 to 200, then that rate is halved. It comes to 22% because now you have taken the revenue from 100 to 200. So the point I'm trying to bring is, if you increase account revenue, particularly the own source revenue, that percentage shrinks. We also hope the equitable share, the money that the national government sends to counties, will increase. That also will enable us to address that problem that we are always told to do not employ more employees. However, there are some critical sectors that you must employ, whether you like it or not. Let's say, like a chief officer, a CEC, a nurse, a doctor, you see, a clinic officer. So, for some cadres, at times you usually employ, then we have to go and make our case when we appear before the people who superintend counties. However, if I get the person who was asking the question right, I think they meant the cashiers whom we wanted to transit them to contracts. Yes, we did that for a good reason, that cashiers did not have a pay slip, and therefore they could not get a loan from the bank. And to remedy that issue, we came up with a policy of getting them personnel number, putting them in what we call IPPB, or rather into the official government system, and that we give them contracts. So the process is ongoing. I think HR can come and elaborate how far they are. Please come and explain how far you are with that process. We'll give you the computer in a minute, but we hope that will make casuals now contract employees, and that makes your life a little bit better for you. Yes.
So thank you, Your Excellency. The issue of shifting from casuals to a contract is almost through. We had to work with the national government, and I'm sure if all goes well, most likely by end of March, all the casuals are going to shift to contract, and they will be paid through IPPD. You have your personal number, you can pick a room, okay, you are just like any other employee. So just patient, because that is not just an issue of the county government, you have to work in collaboration with the national government. So by end of March or April, things are going to be all right. Thank you.
Final question. Fine.
Kindly requesting the county secretary to clear on the state of seconded staffs to KMTC Kagema. Allow me to read it. Please ask on deployment, where some are deployed very junior position despite good papers, work experience, and we are deployed other people we trained and mentored. To whom should we complain to?
So thank you for the question. The issue of deploying staff at Kagema KMTC is ongoing, and I want to say, KMTC, what we are doing right now, we are trying to get some of our staff from our hospital, and you realize we also have a gap. We don't have enough staff in the hospital, but are trying to support our KMTC. So we have already identified about 10 staff. So who should start working on the KMTC as the KMTC stabilized. Regarding employment of our staff with a high qualification, that one is as a result of the current crisis in the unemployment in the whole entire country. So we really want to tell you to be patient, and once vacancies arise and we advertise, we shall give you people the first priority to be observed in jobs regarding higher grades. Thank you.
Now, what about where to conclude to you?
regarding complaints, bring up your complaints through the county secretary. My office is open in case of any issues. And I can also give you my number, the one that you can use for any complaint. Use this number. Just a minute. As I said, the office of the county secretary is open. Come over. You can see me personally. And you can also do me a message using 0703 361 763. I repeat, 0703 361 763. That is a number, contact for public complaint. Thank you. Any other questions? One? I can read. I can read it. The last one. So this one is written, "Hi Nancy." I'm assuming this is Banse, well noted in the meeting, but I was also requesting that we include HRs in the internship program, just like nurses and chief officer, to cater for the shortage, especially with implementation of HMIS. Thank you. This is well noted. Thank you.
Yes, I think first, before we sign out, is to first congratulate for finding time to be with us for almost 1.5 hours. But just to add on that point, we are realizing there are a lot of gaps in HR. You see, on one hand, our finances don't allow us to employ more, but on the other hand, once we automated so much, we saw so many, for lack of a better word, bad things that needs to be done. One of the most glaring issue that came out is our hospitals are quite understaffed. Take like Muranga Level 5 hospital. There was this complaint of people saying we queue for a very long time. So we decided to devolve cash offices. So you go to the dental clinic, you will find a cash officer there or an NHIF clerk. You go to, let's say, to outpatient or any other service point. So that helped to the extent now lines are better. People are moving faster. But now, after everyone is served, we are all converging at the pharmacy. So the pharmacy now lines became longer. So when you look at the pharmacy now, you realize there's one candidate that is completely underrepresented. That is the farm tech. So yes, we brought in nurse interns. Yes, we are adding clinical officers. But I think we have seen another gap in farm tech, and which was not apparent before. And no wonder, when you look at the system, you usually notice people go through outpatient, but they don't go to the pharmacy. Almost 60% of the people don't go to the pharmacy. So when we inquire what would be the reason, one is the lines are just too long. So we are noticing, and we will think a little bit harder on how to fill that gap. Finally, the current effort to expand the physical infrastructure of various hospitals will mitigate some of these complaints that people usually have against healthcare. That is, take like Muranga Hospital, the new block that we are building next to the hospital. It will house the emergency. It will house such and such other departments, and therefore some space will be freed up for extra outpatient rooms. The same also will happen in Kigumo. We hope national government will also intervene in Kangema, and that will definitely mitigate the problems that we always encounter around in this sector. Thank you.
You want some?
Yeah, the issue of the 5 months salary, we are really asking about it.
State it. So ask the question, then you respond.
Yeah, I have so many questions about the nurses' 5 months arrears. And so far, we have a scheduled meeting between all the parties, which will be held on 13th. The governor has confirmed. So we hope and we believe that we'll have a solution on that particular day. The meeting will involve the county government, headed by the governor, the nurses union, by the GS, and also by the Heroes representative Wakili, who has already been invited, the attorney Kirwa. So let us wait for that date. We'll have a feedback on the same. Thank you.
Maybe to add a little bit on that.
For first, that money was not incurred by this county government. It was incurred by the previous county government. So it was just the importance of honoring a campaign pledge that we budgeted for that money. Secondly, that money is already in our budget. Of course, not the entire sum, but our plan is to pay it in installments. But already there's quite a substantial amount in this budget. So we hope the current stalemate is solved before the new budget comes into place in June 2024. Secondly, once we met with union officers representing the nurses, we agreed that we shall pay, and we came up with a repayment plan. Only for the lawyers who represent nurses in court to write a letter and say, no, as you are not involved, we do not support that settlement. So that is the reason why there has been delay in this issue. After your lawyers wrote a letter to us telling us, no, they don't support the settlement between us and the union. So the original idea was that new nurses, you disengage from your lawyers, you come directly to us, we pay you. But as a lawyer, I advise strongly against that, because I know when you try to go behind a lawyer, they usually take you to court and do something called taxation. They raise a bill and they tell you pay us, and the court will definitely side with them. And therefore, you'll find whatever you are supposed to pay you actually goes to the lawyer. So, what is the solution? The solution, number one, as nurses, and probably through your officials, talk to your lawyers. Tell them first to not overcharge you. Usually, we can't pay for your lawyers as we are paying for the amount that you are claiming. That's number one. Number two, agree. Tell them to agree with us as we are ready. We may not pay the entire amount in one single swoop, but we will pay it in staggered form. So my view is caucus, talk to your lawyers, let them be reasonable. We agree, we start paying. The money is already budgeted for in our current budget. So, let me also commend Lucy, your union official. She's really pushes for your interest. She's a fighter. We are not for her, this money would not have been budgeted. So, congratulations, Lucy. But just see now how you will meander around your lawyer's demand for large fees. That's the only issue. But as we are ready, as we have no problem, the money is already budgeted for. Thank you.
So thank you very much. We may not be able to answer all the questions because of time, but we really appreciate any question that you have not answered over here. We shall do it through our text message. So thank you very much. We keep engaging. We are very happy for your listening. We are very happy for the viewers, and you also are very happy for being with us. Thank you, and thank you again. God bless you and bless Muranga County. Amen. Thank you.